When you're disinfecting your plates, you will have 2 paper towels. This will have your dirty PSP plates, and then this will be used for after you've disinfected the plate. You will have clean gloves on, not the ones you use with your patients, but clean gloves. And you'll have one hand that is used for your dirty and one hand that's for your clean. I would suggest your dominant hand be your clean hand. You're gonna get a disinfectant wipe and put it in your dominant hand or your clean hand. This is gonna be my dirty hand. I'm gonna grab my saliva-filled PSP plate. I'm gonna drop it without touching. I'm going to wipe it with a disinfectant wipe, and then I'm going to drop it in my clean cup without touching. And I'll continue until I have disinfected all of my PSP plates. And if you happen to drop one on the paper towel instead, or if something like this happens, you will take care of that at the end. And this is my last one. And I will wipe it and drop it in the cup because I did 4 bite wings, and I'm just going to take this and get it into the cup. So what you'll do next is, remember, this is my dirty hand, this is my clean hand. I'm going to take my PSP plates that have been disinfected, I'm going to sit it to the side. Again, this is my clean hand. I'm going to gather up all my trash, and I'm going to throw this in the trash along with my gloves. And then I will transport with ungloved hands, because outside of my cup is clean, I'll transport this to the scanning area. So you'll bring your disinfected plates to the bar back in the scanning area. Typically the lights will be off in this area just to keep the images from getting exposed to light. But for these purposes, for videoing, you'll notice the lights are on. You'll see that there are gloves available at the bar area and the mounting area here, and you're just going to put on clean gloves. So again, when you leave your room, you will not have gloves on, but when you come to this area to open your PSP plates, you will have gloves on that you've put on here at this bar. So you'll grab your PSP plates. Remember, these are disinfected, they're not sterile, and that's the reason why we want to wear gloves whenever we're opening it. If you look at your packaging, there's a little V here. The best way to open the package is to pull on the opposite sides. You can see how it starts ripping, and you're going to open them and you're going to drop them into this black box. Okay, you can see how you pull opposite and then it falls out. If you notice, I did not touch the black box with this contaminated or only disinfected PSP packaging, and I throw it right here in the trash. There's always a trash right there for you, and I'll continue to do each one and drop it in. And you will notice that this box has a slot in the top of it where the PSP plate falls in, and it keeps it away from the light. So we're going to pull here, and if you can get the camera a little closer, you can see it actually fall into the little slot down in there once it lets go. Okay, once you've done that, these again are contaminated, so you're not going to touch the black box. You're going to take your gloves off. You are going to throw your cup away. Remember, the outside's not dirty. And then you're going to take the black box and you're going to walk to the scanner. So you never ever bring your PSP plates wrapped in your cup straight to the scanner. You always take them to the bar, open them up with gloves on, and then bring them to the scanner in order to go ahead and put them in. So let's talk about the Scanx machine for just a minute. We have several in our clinic. You will notice that there's a couple of lights on the Scanx. This is your power button, and when you come into the clinic, that's part of opening our clinic. We turn our Scanx machines on, and the other thing that you'll see is the eraser button. And what happens is whenever you scan your images into the computer, when they drop out down here in the bottom, they're erased. And we always want to make sure both of these buttons are on whenever you are using the scanning machine. Because if not, and they're not erased, then you can use those same images, or you can use those same plates on another patient, and then you'll get a double exposure, and so they will not be diagnostically useful. So this is what our Scanx machine looks like. Your size 1 plates will go into your far left, and you'll see the little arrows on here. This tells you where you can feed your PSP plates in. And if you notice, there's a slot where the plate fits in. So you can see the little slot right here. So you'll be placing it right into this slot. Okay, so if you're not really careful, sometimes you'll put it in behind the slot. So you just want to make sure it's in the slot. It holds your PSP plate upright, so when it pops up on the screen, it will be straight. So again, you have 4 different areas. This one's for your size 1. These are for your size 2. So the next thing we're going to do is we're going to go ahead and scan our PSP plates. So what you're going to do is pull up your patient chart for the day. You always want to look here in the upper left-hand corner to make sure it's the correct patient. We don't want to scan the wrong images into the wrong patient, so make sure you have the correct patient. And then you'll see this little icon right here that looks like a little flatbed scanner. You're going to click on that icon. You have to be patient, and then you have a box that pops up like this. How you know you're in the right place is if you see 4 sections like this. Because remember, we saw in our scanner there are 4. If you go over and look, remember there's 1, 2, 3, 4 places that you can put your images. So this would not be correct because it only has 1. So what we're going to do is we're always going to tell you, you always have to be on the tooth when you're scanning. And look, you have 1, 2, 3, 4 slots for us to put our PSP plates in. So that's awesome. Now, the next step you're going to do is you're going to push the play button, okay, which says start image scanning. So we're going to click the play button. If you notice, they all turn green. And guess what? Green means go. And look at our scanner. We have our 4 slots and they're all green. Green means go. So what we're going to do next, if you look at our black box, there's some little indentions on the side. If you push those, it allows you to open the box. You can see our PSP plates are inside. You want to minimize the amount of time that this is open. So what I would do is open it, grab a PSP plate out, and then you're going to place it in one of the slots. Now, one side of your PSP plate is blue. And I always say blue to the drum. So when you're putting it in the scanner, the blue faces the drum so you can see the numbers. And again, you just place it in the slot, you give it a little push, and if you look when the slot's in use, your number is yellow. So which means yield. Do not put, it should be stop instead of yield. Do not put another PSP plate in that slot. So let's go ahead and put another one in. We're going to the next slot. Give it a little push. You can see that this slot's being used. But look, number 2 is available. It turns green when it's available. Even if it's green, I always look down here to see if the PSP plate has dropped out. And you can see it's dropped out of slot 2. So I know that it's safe to grab another PSP plate and put it into slot 2. Give it a little push, and slot 3 is ready too. So we're going to give it a little push. So now they're all in, and I always look at the bottom and I count. I know how many I put in, and that's how many that should come out. So I have 2, so I have 2 more that will be coming out. So while that's happening, if you'll come over to the screen, what you'll see is my images are popping up on the screen. And these are some funny looking teeth, right? These are paper clips. They're metal, so they show up on our images. So once all of them have popped up like this, we can hit close window. And we don't want to assign numbers now, so we're going to say no. We'll teach you that a little later. And then they're all here. Okay, so what you do next is you have to place these in the correct area on our mount. So we're going to get rid of these because we want to show you how to place some of these images. So whenever you're placing an image, you would double click it and it gets big, and you see this little 0 up here in the corner. You will click on the 0, and then it allows you to pick where that image needs to be placed on this screen. So say for instance it's a maxillary right molar projection. I would click those 3, and here's another little trick. If you click the first one and the last one, it'll save you a click. And then hit done, and then we can hit X here to make it small again. You can see it is placed in that exact spot. So say this is our premolar. Let's do one more. We're going to double click, come up here, click the 0, and then it's our premolar projection. So I'm going to click my 2 premolars, and then I'm going to hit done. And then I can hit the X to make it small again, and you can see it's up here by the premolars. So that's how you mount your images that appear on your screen after you've scanned them. When you're all done, you're going to click this X, this white X in the green circle, and it takes you back to the main chart, and then you will hit the X over on the far right, which says close, because you do not want to leave this up for HIPAA purposes. And then you're going to say yes, you want to minimize your chart. And then you're all done, and you can open these images back at your unit for the dentist to take a look. Now, the last part that you're going to do is you're going to take your black box and you're going to place it back over on the counter for the next student that comes along. And then we have to repackage our PSP plates for the next person to use them. Again, we have all 4. We had 4 that we put in, so we want to make sure we have 4 that come out. And you have the repackaging supplies are kept in the clinic, and these are size 2s and these are size 2s. So we're going to take our PSP plate, we're going to slide it into the package, and then we're going to peel this. It's kind of like a Band-Aid sticker. You're going to peel it, and you're going to make sure the PSP plate's all the way down because you don't want it to get caught in the sticky part. You're going to make sure it's really good and sealed, and you're going to do all 4 of those, and then you'll return these to the proper place.